Eating disorders.
When you become so preoccupied with food and weight issues that you find it harder and harder to focus on other aspects of your life, it may be an early sign of an eating disorder. Eating disorders are serious but treatable mental and physical illness that can affect all the people. Without treatment, eating disorders can take over a person's life and lead to serious, potentially fatal, medical complications. In this paper, we will talk more about what an eating disorder is, the most common in society, probable causes, treatments, and its consequences in people's lives. It's important to remember that this video was created for educational purposes only. Please do not use it for self-diagnosis or diagnosing other people. If you think you may have an eating disorder, we recommend that you seek expert help.
Eating disorders are conditions and serious changes in a person's eating behaviors, whether caused by the purposeful lack of food intake or by binge eating, and can often, in case of late or non-existent treatments, lead the individual to death. In general, eating disorders start from an exacerbated concern with regard to physical appearance and usually manifest in adolescents and young adults. Causing damage to the individual's emotions, these disturbances make them see a distorted image of themselves and their bodies, making them doubt who they really are and attribute their value to the numbers of the balance, resulting in difficulties in socializing and the evolution of other areas of their life. In addition to all the physical and psychological consequences resulting from the disorders, the lack of absorption of nutrients by the body of people suffering with them can trigger several other cardiovascular, digestive, bone and tooth, mouth problems, or even weaken the body's immune system, making it conducive to new diseases and infections. Added to all these many problems, they state that eating disorders cause more deaths than any other psychological illness, and according to the National Health Service, most of these disorders are directly related to social networks. The search for the perfect body and the constant struggle to fit socially imposed standards of beauty have, of course, gone too far, and continue to make young people and adults decide to sacrifice themselves daily in exchange of some likes and compliments that are certainly not worth their lives.
Some types of eating disorder. Anorexia nervosa is likely the most well-known eating disorder. It generally develops during adolescence or young adulthood and tends to affect more women than men. People with anorexia generally view themselves as overweight, even if they are dangerously thin, tending to constantly monitor their weight and present obsessive-compulsive symptoms. This eating disorder is officially categorized in two subtypes, the restricting type and the binge eating and purging type. In several cases, anorexia can result in heart, brain, or multi-organ failure and death. People with bulimia nervosa frequently eat unusual amounts of food in a specific period, and each binge eating episode usually continues until the person becomes painfully full. Individuals with this eating disorder attempt to purge behaviors, such as vomiting, unrestrained exercise, or laxatives, to compensate for the calories consumed and relieve gut discomfort. However, different to anorexia, individuals with bulimia usually maintain a considered normal weight. Believed to be one of the most common eating disorders, especially in the United States, the binge eating disorder typically eats unusual amounts of food in short periods of time, feeling a lack of control during these episodes. People with binge eating disorder don't use purging behaviors or calorie restrictive, so they often give overweight or obesity. Avoidant restrictive food intake disorder is a diagnosis previously reserved for children under 7 years old. Individuals with this disorder experience disturbed eating, either due to a lack of interest in eating or distaste for certain smells, tastes, or textures. It is important to note that ARFID goes beyond normal behaviors, such as picky eaters or lower food intake. Moreover, it doesn't include the avoidance or restriction of foods due to religious and cultural practice. In addition, less common eating disorder generally fall under three categories: purging disorder, night eating syndrome, and OSVAD, other specified feeding or eating disorder, which includes any other conditions that have symptoms of an eating disorder but don't fit into any of the categories above.
The causes of the manifestation of eating disorders vary greatly according to the profile of the individual and the disorder to be analyzed, but it's possible to highlight some factors in particular. Risk factors will generally be habits and behaviors that promote the development of eating disorders and are routinely seen as harmless. It can be highlighted, for example, the constant feelings of guilt, bad eating habits, excessive code of the body, low self-esteem, which can cause distortion of body image, among other things. Biological factors, on the other hand, are not directly related to all eating disorders, but indicate some biological risks that can influence each of them, such as the occurrence of diabetes, hormonal activity, among others that make each disorder even more particular. Finally, psychological factors study the occurrence of eating disorders from emotional disorders, such as perfectionism, excessive focus on weight or appearance, social anxiety, high expectations, phobias, depression, etc. Data collected in the last few years by WHO, World Health Organization, shows that 2 or 3 among 100 people in the whole world have to deal with some kind of eating disorder. Brazilian numbers, however, are pretty higher than that, with almost 5 of 100 people being diagnosed, a large amount of this being between 14 and 18 years old. That is associated with the self-criticism and perfectionism many teenagers develop over their bodies over this age. During the COVID-19 pandemic, these numbers might be rising, since most of the world has been doing fewer physical exercises and has been more connected with social media, not realizing sometimes how harmful they can be or the toxic idealization they constantly promote.
There are many different consequences for each type of eating disorder, both physical and psychological. Physically, many times a person ends up forcing themselves to eat more than they should or could have, or they find a way of making the food out because of nausea or a form of guilt. Anyhow, they both are unhealthy habits that put their bodies into uncomfortable situations with future worse consequences, such as sleeping issues, severe weight loss and disnutrition, intestinal perforations, infections, intoxications, and nutritional deficiency. In the psychological side of consequences, those can be as strong and serious as the physical ones. They constantly come from different risk factors such as genetics, low self-esteem, family historic, perfectionism, or maybe diets. Because of that, those people may have even worse sleeping issues and impulsive vomit induction, eating phobia, uninterest in food because of texture or taste, repeated regurgitation, ingestion of uneatable substances, eating compulsion, and in the most extreme cases even get to suicide. There is not a certain way that makes eating disorders appear, neither there is a certain consequence for all the victims, so there is naturally not a way of dealing with them either, since each case is personal and individual. So it's recommended for everyone who feels symptoms of one of those disorders to go look for a psychiatrist, which will look for other mental disorders such as depression and will indicate the necessary medicines for them. Also a psychologist who will help dealing with emotional subjects and the way a person sees their own bodies. And not as important, a nutritionist that will be responsible to establish a healthier relation with food. Sometimes a physical education professional may help too.
In short, there are 6 types of eating disorders that can happen only or together with other disturbances and problems. Based on it, it is a common knowledge that the causes, the manifestation, the consequence, and the treatments vary according to the profile of the individual and the disorder to be analyzed, but it's possible to highlight some factors in particular. Even people cannot self-diagnosticate or diagnosticate other people. The appearance of one or more symptoms described here or searched in reliable sources of medicine implies that they need expert help, because the treatments are individual and personal based on each disorder, problem, and context that the person lives. Finally, we need to normalize the discussion and the debate about the eating disorders, because all those situations are extremely common in the world. In as much as 2 or 3 among 100 people in the whole world have to deal with some kind of an eating disorder. With this, we need to stay healthy in all the contexts, doing exercise, eating healthy and balanced foods, focus on mental health, and if possible, maintain constant care with health professionals.
Thanks for watching and hope you enjoyed our presentation. Have a nice day.